guidelines of India 2020, and whatever slides, almost some 40 to 45 slides will be, if you want you can note it down. This is just a PDF and I have converted that PDF into PowerPoint. That's all. So what I am going to discuss from now is already given in this Ministry of Health, Family Welfare, government.in PDF telemedicine. So this, if you want, you can note it down this website. So if you type this website, whatever I'm going to tell is already there present in the form of PDF. So I'll just communicate it to you through this session. Yeah, definition of telemedicine is delivery of healthcare services where distance, especially some place distance will be a matter. He wants to see only that doctor, either doctor has shifted or the patient has shifted to a different place, but is not able to come a long distance and he wants to do telecommunication. Means I already told patient has to fix the telecommunication, not the doctor. And you can call the doctor and ask for teleconsultation. Doctor can accept. It is valid. Delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technology. Yeah, one of the technology is smartphone, any technology format for that matter, for the exchange of valid information for diagnosis. This is the definition of telemedicine. According to Minister of Health or even WHO gives the same definition. Treatment, prevention of disease, research, evaluation for the continuing education of healthcare providers. Yeah, telehealth is, or otherwise telemedicine is a subdivision of telehealth. Telemedicine is mainly involvement with the diagnosis of the medical condition, prescribing for that medical condition, treating that medical condition, and giving the counseling, what to be done, what not to be done for that particular condition, which you have found out through telecommunication. Telehealth is the overall thing. It is not only diagnosing, it involves health and health related services like medical care, medical facility providing, patient education. Yeah, patient education also comes under telehealth, health information services. All those things which is got via telecommunication and digital communication technologies is called as telehealth. The RMP, we all know, registered medical practitioner. It is there from Indian Medical Council Act 1956. After we complete the MBBS, everyone has to register in that Arumbakam. As of now, it is in Arumbakam. We have to register in Tamil Nadu Medical Council, which comes under IMC Act 1956. So only RMP can do teleconsult. Obviously, I think there no doubt will be there for the students. Only if you are registered, you are eligible for medical practice. And those who are eligible for medical practice only can do teleconsultation also. So RMP is a person who is enrolled in the state medical register or the Indian medical register under the IMC Act 1956. So long back that act is there. Yeah, all these are general thing I already explained. So telemedicine is to enhance healthcare service and access to all. Yeah, still in some rural areas, there is a difficulty in approach to the doctor. Even though, for example, if you take Tamil Nadu, more doctors we say it is going to be the upcoming situation, but still some people are not able to have direct access to the doctors. And there is a possibility that this telecommunication will bridge the gap between the patient and the doctor. Means definitely we can utilize it. There are various channels for communication or the platforms like audio message, voice message, text message. Even text message is a form of telecommunication. For example, patient will just chat with the doctor. So today I had this problem, and the doctor can reply, and I will tell in the upcoming slides whether he will be able to prescribe or not. The digital data exchange is there. Yeah, now coming to exclusion criteria. Again, I want someone to answer this. What do you mean by this? Specifications for hardware or software, infrastructure building and maintenance is excluded from telecommunication. What do you mean by that? I don't think anyone will be able to answer this.
Sir, so we are not able to see your slide, sir.
இப்போ மூவ் ஆகுதா?
சார் நோ சார், ஸ்லைடு வரல சார்.
சார் ஸ்கிரீனே ஷேர் ஆகல சார்.
இப்போ சொல்றீங்க, வெயிட் வச்சு. Now?
Yes, sir, it's visible, sir.
Yes, sir.
Moving.
Yes, it's moving, sir.
Yeah, these we discussed a common doubts, sir. Can we practice telemedicine? Yes, we can practice. You can use your mobile phone. No specific app is required. We cannot request patient. Patient can request the doctor. So, namma convenience kaga, we can't ask the patient for going teleconsultation. Very, very important. Yeah, all this I told we will discuss. Yes, it is not prohibited in India. And whatever slides I am going to discuss is based upon this app. This you can note it down. MOH, Ministry of Health, Family Welfare.gov.in, PDF telemedicine. So if you type, going to present will automatically come to you in the PDF formats. So I'm going to make it easy. Telehealth is overall view. Telemedicine is especially doctor communicating to the patient through digital. Yeah, RMP and all will leave. Yeah, now coming to exclusions. Yeah, can anyone answer this? So these are the exclusions for telemedicine, like specifications for hardware or software, infrastructure building and maintenance. What do you mean by that? See, this is also excluded. Data management systems involved. What do you mean by this? The guidelines for telecommunication 2020 specifically or explicitly exclude these following: specifications for hardware or software, infrastructure building. Yeah, this is little bit confusing. What they want to mention is there is no need for any specific hardware or any software or any infrastructure building for communicating. Just a mobile is enough, or whatever tools you are having, that is enough. There is no specific guidelines for what tool you have to use. That's what they are mentioning. Yeah, it is little bit confusing. Same way, no data management system is needed. For example, if I'm just having a mobile phone, a patient is now contacting me. Sir, I am now in Trivandrum. I went for Kerala 1 week back, sir. My diabetic medicines are about to complete, sir. I have done my fasting postponed, sir. I want to get back to you, sir. Can I consult you, sir? No, I will give appointment for him. Okay, now I am in a session. After completing, you contact me at 7:30 p.m. You consult me through you just call me through mobile. That I will decide whether I want to speak in audio or video call, depending upon the clinical scenario. So no specific hardware or software there is no specification. Yeah, it is not that I have to use only this software. It is not that I have to use only this online app. Not necessary that I have to use this specific app. No guidelines from from Indian Medical Council or NMC that this specific app has to be used. That's what they are mentioning. Yeah, can anyone tell what is this? Does not provide for consultation outside jurisdiction of India. So what does it mean? Does not provide for consultation outside the jurisdiction of India. Quick. It is like one-way traffic. No one wants to answer.
Outside the Indian border, sir.
Okay, what outside Indian border? What?
Like you should not do consultation for a person who is outside India, that is abroad.
No, not like that. You little bit reverse la. I can't do a teleconsultation when I am outside India. That's what it means. I am registered to practice only in India, Indian Medical Council, IMC Act. So when I am going for a foreign trip or abroad, I can't do teleconsultation. That's what it's meaning. I can't do teleconsultation in India. So remember that. I can do teleconsultation within India. So that point also you should remember. Again, what is RMP? It is going to registered medical practitioner. We will skip all this. Yeah, now they have, before it was told that an online program is necessary for RMP, which is made available for the Board of Governors. As of now, there is no online program specifically, and it has been revised. As of latest telemedicine guidelines 2023, there is no specific online program. So I need not want to complete any online program for doing teleconsultation. Just you should know when to do teleconsultation, when to avoid teleconsultation, whom to do, whom not to do. Those guidelines alone is enough. So I'll go to next slide. Yeah, various tools are there like WhatsApp, very easy tool. Facebook is there. Internet, mobile, landline phone. Even some doctors now use landline phone. So many Skype is there, email is there, fax is there. Even Gmail for international teleconsultation and all Gmail. Yeah, irrespective of what tool you use, the core principle remains the same. So any tool for telemedicine can be used. Yeah, now coming to telemedicine applications, it is usually divided into 4 basic types. the mode of communication. What tool you are going to use, timing of the information transmitted, what is the purpose of the teleconsultation, and how the interaction between the individuals is going, whether it is patient to registered medical practice or patient to doctor, or whether the caregiver who's taking care of the patient is talking to the RMP, or for example, I am telecommunicating with a patient and some cardiac problem is discussing and I want to clarify the doubt with another cardiologist. So what I will do, I will call a cardiologist and discuss about my patient. So that is also teleconsultation where one RMP, one registered medical practitioner is talking with another registered medical practitioner about the patient whom I am seeing. So all these are various types of telemedication. Yeah, according to the mode of communication. So 4 types. According to the mode, according to the timing, according to the purpose, and whom are speaking to each other. Yeah, according to the mode, I already told. Video call, audio call, even text based. Asynchronous is email. Any disadvantages of email telecommunication? What are the disadvantages? Email telecommunication. Quick. Yeah, the doctor may not open the email for some days. You will see after 10 days the email which the patient has replied. Some are in international level, some will be emailing. The patient will be emailing the X-ray report, scan report, all those things. The doctor may miss to see that. So all those things are there. Yeah, WhatsApp is a very common tool. Google Hangouts are there. Facebook Messenger is there. Some tool they will be utilizing. Yeah, this is according to the mode of communication. So first step is over. According to the mode of communication, you are having video, audio, message, chat message, even mail, Skype, many things are there. Whichever you are using, you can use it for telecommunication. That is according to the mode of communication. According to the timing, yeah, again there is real time. For example, if you are going to make a video, so if the patient is calling, but the patient is first informing the doctor that is want to make a video consultation, is calling video means that comes as real time. So real time video or audio or text, asynchronous, like I told, any mail, that means it will not be, the patient may not be going through the same time itself, or doctor will not be seeing. That is called as asynchronous exchange. Yeah, this is important. You can note it down. According to the purpose of the consultation, first time when you are consulting, it is coming as first consult. Yeah, follow-up consult, there is a term in telecommunication. Follow-up consult means if you are going to meet the same RMP, registered medical practitioner, within 6 months for the same complaint. For example, a chronic diabetes is a chronic condition. Those who met me today and I'm writing him metformin, any sulfonylurea drugs for diabetes, after 4 months is coming, that is, he is coming through telecommunication for the same condition means he comes under follow-up. But if the same patient is coming after 6 months means it is a second consultation. It is not first, it is not follow-up. You will be considered as a new patient. So all those for record it is given. First consultation is first time telecommunication. Follow-up is the same patient communicating with him within 6 months for the same complaint. That is very important. Within 6 months, the same patient, Mr. X. Mr. X is communicating with me through telecommunication today for some diabetic condition. Mr. X is after 3 months is coming for me for hypertension, different. Initially he was not having hypertension. Now he has developed hypertension. Then he will not come under follow-up. He will again be a first consultation. So that you should note down. So follow-up consultation is, first criteria is within 6 months. Second criteria is same medical condition. So the medical condition is differing means it is not coming under follow-up. It will be a different consultation. If the follow-up consultation is after 6 months means you will not come under follow-up consultation. So there is 2 types, first consult, follow-up consult. So based upon this, you have to segregate him, whether it's first consult or follow-up consult. Yeah, emergency consult is another important. Yeah, everyone will have the doubt. During emergency, the teleconsultation can be done. Yeah, emergency procedures cannot be done, but first aid can be given. For example, any road traffic accident, someone knows the doctor, whether he is communicating through telecommunication, he can tell how to be the position. First aid measures, yeah, as the name given, first aid can be done through telecommunication, and immediately the nearby doctor has to be approached and physical presence should be there. Yeah, this is what I want to tell. In all cases of emergency, the patient must be advised for an in-person interaction with an RMP at the earliest, but before that, telemedicine services can be still provided for first aid, note it down, for first aid, for life-saving measure, any counseling, yeah, for any RTA, any communication like them, ask him to, or ask some persons to carry him, to bring him over the side, neck prone position, whatever position he wants to be. If he is not knowing CPR, definitely we can give CPR through telecommunication. We have to give instruction, like do this 30:2 method, 15:2 method, or 30:1 method. If the particular person who is available there at the scenario is not knowing, so nowadays we have to teach everyone the basic life support, as we students also regularly do that workshop. If he is not doing through telecommunication, we can definitely do BLS, no doubt in that. That BLS comes under first aid. Yeah, all these are individuals involved. Patient to RMP is a common telecommunication method. Caregiver means who's along with the patient, who's taking care of the patient. Nowadays, home care is very common. For example, cancer patients, chronic cancer patients. So, some home care will be given to him during his chronic therapy, or whether he's on chemotherapy, for example. So, the caregiver can telecommunicate with the doctor regarding the patients. So, that comes under caregiver to RMP. The RMP to RMP I just now discussed. Can anyone tell me where RMP to RMP comes in telecommunication? Just now I told an example. For example, if I have any doubt on the patient cardiac status, I can consult my cardiologist friend through telecommunication. That comes as RMP to RMP. I am speaking to another doctor about the patient status. Yeah, health worker is another important community health worker. He can also communicate to registered medical practitioner on the patient. Yeah, health worker can facilitate a consultation session for a patient with an RMP. In doing so, the caretaker can give the history, examine the patient, or otherwise caretaker will examine the patient and inform the patient status to the doctor. RMP means doctor. I am just telling whatever is given here. RMP is registered medical practitioner. And they can, so here the health worker acts as ambassador. So what health worker does? Health worker will tell the physical examination of the patient to the RMP, and whatever RMP tells, it will be conveyed by the health worker to the patient. I will skip all this technology used. Though newer technologies are, still we are going to follow video, audio, text message, as I mentioned, email, fax, chat, messaging, all those things. Yeah, again, the slide is given. All these are present in this. See, each and every slide you can have this PDF. Ministry of Health, Family Welfare, Government, PDF, telemedicine. Yeah, video, what advantages, what disadvantages is given. Advantages is you are going to see the patient through video. So little bit better communication will be there, better understanding of the doctor-patient relationship will be there. And RMP can see the patient, discuss with the caregiver also. Limitations, you cannot do physical examination. I cannot touch his trachea and check. I cannot check his apex bit. By video, I can see him, but I will not be able to do the complete physical examination, which we understand. Audio, advantages is it is convenient and fast, unlimited reach, so suitable for urgent cases. No separate infrastructure is required, real-time interaction, but disadvantage, I cannot see the patient. And identification needs to be clear. And very important, please note it down. Before I do any telecommunication with the patient, patient ID is important. Patient also should know to which doctor is speaking. Without knowing that he is speaking to Dr. Sendil Kumar, MBBS, MD, whatever it is, he cannot communicate. Without knowing to whom he is speaking, he should not speak. Same as me, if I speak to a patient, I should know the patient details. I should know his ID details. I should know from where the patient is speaking. All these things are very important in documentation. The ethics is very important. So both the doctor as well as patient should be knowing whom is speaking. Yeah, test based is very, very vague. I cannot see the patient. I cannot listen to the patient voice. Yeah, it is very difficult to establish rapport with the patient. Advantage is very quick. Yeah, now regularly patient message, sir, I'm having 3-4 times diarrhea. If the patient is regular, I'm having 4 times diarrhea, sir. I had food poisoning yesterday, sir. Now immediately I will reply. You as of now take ORS, no need for antibiotics. We'll check for 1 or 2 days. Drink lot of water. Next day again you will message, sir, still diarrhea not controlled, sir. Then if I want, I will ask him to do teleconsultation through video call, or even chat is a type of teleconsult. That's what I want to tell. Even chat comes under a type of teleconsultation. Asynchronous is email, I discussed already. Email, lot of disadvantages are there. I may not even look at the email because of busy schedule. Yeah, telemedicine should be appropriate and sufficient as per the context. They should consider the technologies available and their adequacy for diagnosis before choosing to proceed with any health education or counseling or medication. Follow-up is important. Yeah, we should not fix during teleconsultation. Each patient is different. For example, a new patient may present with a teleconsultation with a simple complaint as headache, but some other patient with diabetes may consult for a follow-up with emergency such as diabetic ketoacidosis. So once I sense that he may go for diabetic ketoacidosis, I have to be very careful. I have to advise him to go to the nearby hospital or a proper follow-up should be given. I can't just treat for diabetes alone through teleconsultation. So a standard of care should be maintained. So try to utilize as much as possible the technologies available. Yeah, this I already mentioned. Note it down. Both patient and RMP should be knowing each other's identity. And the RMP or a doctor for that matter, the doctor should verify and confirm the patient's identity by name, age. Same, whenever the patient enters to the clinic, we ask his name, age, sex, address, weight, whatever it is, email ID, phone number, registered ID, all those things should be noted. The RMP should ensure that there is a mechanism for a patient to verify the credentials and contact details of the registered medical practitioner. Again, identification is important. I will skip this. Mode of telemedicine I already described. Video mode, audio mode, test mode, advantages, disadvantages I discussed. Please note it down. Patient consent is very, very important. Without getting the patient consent, I cannot do teleconsultation. So patient should give me the consent, then only I can do teleconsultation. I cannot tell him, no, I'm busy, I cannot come and see you now. You please call through the phone, I will speak. You please go through this app. There technician will be there, staff nurse will be there. You will communicate me through phone, you please call through phone. Like that, I should not communicate him. So patient consent is necessary for any telecommunication. Yeah, all this I discussed. The exchange of information. Again, please see that when you are doing teleconsult, all patient records should be maintained, including case history, investigation reports. Any investigation report, you can ask him to send, whether a message or now it's very easy. Video call is there. He can send through WhatsApp. Whatever message, whatever communication is having, the doctor is having. Yeah, first consult, follow-up consult. I already told. Can anyone tell me the difference between first consult and follow-up consult? The first consult is first time the patient is communicating through teleconsultation. What is follow-up consult? I explained. Two criteria I told for coming under follow-up consult.
Sir, there is the same complaint for the follow-up consultation.
Yeah, correct.
And also after 6 months, there is a new consult.
Okay. He is coming for same diabetic, my regular patient, same diabetic problem is coming to me after 6 months. He comes under first consult or follow-up consult. A patient is coming after 6 months for the same complaint, whom I checked before. Now he comes under first consult or follow-up consult.
6 months, it must be first consult.
Yeah, correct.
Again.
That's what's here. More than 6 months means first consult, no doubt in that. Within 6 months only, he comes under follow-up consult. But within 6 months also, if he's coming for some other complaint, that comes under first consult. That's what. All these things are not needed, but we can remember. Anyway, this is given in the guidelines. And as you told correctly, it is correct. So know what is first consult, what is follow-up consult. Again, health education, counseling, all these things we can discuss through telecommunication. Yeah, please note it down. The carryover message of today. Don't prescribe medicines without coming to appropriate diagnosis or provisional diagnosis. That comes under professional misconduct. You can note it down. I will read this. Prescribing medications. Anyway, telecommunication, finally I have to give medicines. I have to give e-medicine, e-prescription, or I have to write the medicines in my prescription pad and send it through WhatsApp. Whatever it is, it becomes a document. So professional accountability is there and it is very important. I will just read it out. If a medical condition requires a particular protocol to diagnose and prescribe, as in the case of physical examination, the same applies to telecommunication also. But the registered medical practitioner may prescribe medicines via telemedicine only when he is satisfied that he has gathered adequate and relevant information about the patients. For example, I am making telecommunication to a patient who opted for that. I am not able to come to a diagnosis. What should I do? I am not able to diagnose whether he is suffering from LRI or URI or UTI for that matter. Can I give a prescription like linezolid 600 milligram, metrogel, whatever it is? Can I prescribe, or what should I do next step? I am not able to come to the diagnosis. Through the way we spoke or whatever information is given is not adequate for me to come to a diagnosis. What should I do? Next step.
Emergency, we can, if it is a critical patient, then we can do first aid, and we can call the patient for consultation, face to face.
I have to ask him to come for next visit, or I have to ask him to do further evaluation because I'm not able to come to a diagnosis. So I will tell him to do further. For example, if I want to do urine culture, I will ask him to do urine culture and the report will come in 3 days. So after 3 days, you get back to me. If you want to come in physical, you come in physical, or you want to communicate through telecommunication, you communicate. So without coming to a appropriate diagnosis, if you're not able to diagnose at all, don't give medicines through telecommunication. Even for physical, it matters, but physical will be able to assess. We put that all those things. So without coming to appropriate diagnosis, don't give medicines. If you are giving medicines without appropriate diagnosis or provisional diagnosis, it's not a definite diagnosis. Even if you suspect, you can give, but if you're not able to suspect at all, don't give medicines. That's what it comes under professional misconduct. So until you come to appropriate diagnosis, you have to communicate with him. Yeah, now coming to the medicines. What medicines I can prescribe through telecommunications? We have list 2, list. Any idea? What is list 2 medicines, list A medicines, list B medicines? Any idea? I will learn. Maybe final year students may be knowing upon this. List 2, list A, list B. What are these medications list? Okay, I'll show that slide here. Yeah, I can issue a prescription and transit through telecommunication. Once I know that a provisional diagnosis I have arrived. Yeah. List 2 is general medicines like ORS, paracetamol, or over-the-counter medicines. List 2. So list 2 medications I can give through any mode of video for chat. List A medication like any anti-diabetic drug, any antihypertensive like metformin, for example, which is a very common anti-diabetic drug which is bigonettes, metformin. It comes under list group A. So list group A medications, when I can prescribe, only through video consultation, not through audio or not through message. So that you should note it down. For first follow-up consultation, if I have already made first consultation, I can give list A medication. Yeah, list A. List O can be given even through chat message. List O is over-the-counter medication like thing. General medications like paracetamol, ORS solution, mefenamic acid, like that. List B is the medications which has to be used with caution. Yeah, list B medicines can be given with any mode of consultation, and nature of consultation should be follow-up. Very important. Here, it is first consultation. For list B medications, only for follow-up, you will be using the list B medications. It can be any mode. Prohibited medicines, please note it down, can never be given in teleconsultation. Prohibited medication, it is a long list like barbiturates, phenytoin, narcotic medicines, all those things. Maybe some cases it may be required in antipsychotic medicines, but those medications I cannot. Prohibited medicines, I can't now name what are the prohibited medications. Please remember, all the prohibited medicines should not be prescribed, whether audio or video or any tool should not be prescribed. Any mode of consultation, don't prescribe prohibited medicines. Whether it is a first consultation or follow-up consultation, don't prescribe prohibited medicines. That also is a carryover message. Yeah, duties and responsibilities. I gave a general idea. Can you tell so far in discussion what are the duties and responsibilities of a registered medical practitioner during teleconsultation? Quick fire round. Quickly tell what are the duties and responsibilities as of now for telecommunication. What should I follow? Anyone? I see only one student answering. Quick, what are the duties and responsibilities? What should I do? What should I not do during teleconsultation? No one wants to answer. Or all in hybrid mode. or shall I call out?
But participants, you can answer or respond in chat box also.
Jai Shri. I think all are muted and left. Virat Shah. Radhipriya might have left, I think. Radhipriya is there or left?
Yes, sir.
Yeah, now answer. So far, what to be followed, what not to be followed, as of your understanding.
You ask only for symptoms and
I think I have to mute her.
personal information, sir. In
Can I request the patient for teleconsultation? Sir, okay, we are also running out of time. I will finish it there. Okay, mute. Yeah, misconduct. One misconduct I told, without coming to provisional diagnosis, don't prescribe the medicines. If you are prescribing the medicines without coming for a suspected diagnosis or provisional diagnosis, if you are going to prescribe medicines, it comes under misconduct. If you are not knowing the identity of the patient to whom you are speaking, it comes under misconduct. One more thing, if you are prescribing the medicines from the prohibited list, I already told, list 2, list A, list B. List B, no mode. Whether you are speaking in audio or video or chat, you never prescribe any prohibited medicines. List that is coming under prohibited, yeah, prohibited. Not to be prescribed, not to be prescribed. Whatever be the nature of consultation, whether first consultation or follow-up consultation, whether audio or video or test, no prescription, prohibited medicines. If you are going to do all this, it comes under professional misconduct. Yeah, very, very important. RMPs are not permitted to solicit patients for telemedicine through any advertisement. Actually, it is somewhere very common. I should not advertise myself in any app. For example, some telemedicines, not telemedicines, some online app is there. There the rating and all will be put. For example, Dr. K. Sindil Kumar, rating out of 5, 4.8, 4.7. That ratings and all are not allowed, and no apps should promote any doctor. Hospital, corporate hospital, that is different. Personal propaganda of doctor should not be done, and in telecommunication also, the propaganda of ad should not be promoted, or it is not appreciated. Yeah, which are not permissible, just read it out. RMP is insisting on telemedicine. That's what I told. A patient is willing to see you, but I'm telling him, why you are traveling, don't come. I will do teleconsultation. It's not permissible. Yeah, very, very important. Whatever patient is sharing through teleconsultation, I cannot share that images without his consent. Maybe I can get his consent. For example, a pneumonia patient is sharing his chest X-ray. I can get permission from him. I want to show to my students this X-ray of pneumonia. Can I share the X-ray? Then he will definitely tell, okay, sir, no problem, sir. I have to get a consent from him if I want to share his any images, if I want to use his data. So all these are very sensitive and private issues. Yeah, RMPs should not upload any explicit picture of the patient on social media without his consultation. Yeah, those who are using telemedicine to prescribe medicines should not use the restricted list of medications. RMPs are not permitted to solicit patients for telemedicine through any advertisement. Yeah, this I already told. I will not be using any specific app. You please contact through that app. You please contact through that app. Like that, I cannot promote any app, or for that matter, anyone else should not promote me. It should be one-to-one doctor-patient, or doctor caretaker, or doctor healthcare worker, or doctor to doctor when I want to get an opinion from another doctor. I told 4 modes. Yeah, documentation is very important. Already I told. Yeah, fees can be same fees as physical. It's not that since I'm not seeing the patient, I should get less consultation. It's not that since I'm using telecommunication, I am making the patient comfortable. I am not making him travel. I am preventing his travel charges. I am preventing his time. So I can charge more. Not necessary. Whatever consultation I will get in physical consultation, same consultation can be charged for telemedicine. So it is not fixed. Whatever doctor charges, he can charge the same fees for telemedicine also. For example, consultant will charge a little bit more. General practitioner will charge less. The same can be got for telemedicine also. Yeah, if necessary, a fee receipt or invoice should be produced. Same thing, if I want to give medicines I have to inform him that these medicines are prescribed. Better to write generic medicines along with the company name if needed. Don't just write the company name alone. If possible, for example, if I'm writing Glynas, which is a company name, but in the bracket I have to write glycoside, which is the generic name. That would be better. Yeah, I will skip this teleconsultation process and all. Same thing. I will start a teleconsultation. Patient identification is the second step. Then I will quickly assess what are the symptoms, signs. I will ask him what problem you are facing, how many days you are facing, all those things. Fourth step will be exchange of information for patient evaluation. Fifth step will be patient. I will decide whether I am able to provisional diagnose. If I provisional diagnose, I will start my management. Then I will start treatment. Yeah, follow up is also I will tell him when to follow up next, either physical or teleconsultation, depending upon the situation. Yeah, caregiver I already told. Consultation between a patient and RMP through a caregiver also can be done. But caregiver, yeah, for example, the caregiver should be given authorization by the patient. The patient should initially inform that I am suffering from chronic disease so and so, and he is the one who is taking care of me. You please convey the messages to him, he will convey to me. So a caregiver here will be a messenger for the patient, and the doctor can communicate to the caregiver through telecommunication. That also can be done. Any idea age limit anyone can answer? Can I give teleconsultation to a 15-year boy? Any idea? A 15-year boy. Quick, anyone answer? 22 அப்படியே தான் இருக்கீங்க, but no one is answering. Yes or no? Can I give a telecommunication? Can I do telecommunication to a 15-year boy? A 15-year
No,
boy.
sir.
What?
No, sir.
Yeah, actually, he should not directly speak to me. A guardian should be along with him, especially less than, it is mentioned 18 years in 2020. Now it is age 16 or less. For otherwise, minor should not directly communicate with the doctor through telecommunication. Maybe his father should be there, his mother should be there, or guardian should be there for but telecommunication can be done along with the caretaker. If he is a minor, that point also you should note it down. Yeah, all this I have discussed. Patient consent is very important. In case of emergency, I told what to be done. First aid can be given through telecommunication, like what should be done, but you should also instruct to him to immediately shift to the emergency or to immediately consult a nearby doctor. You may not know the seriousness of the situation there, which you may find out through telecommunication. Patient identification is important. Patient should also know to identify the doctor. Doctor's register number, all those things you should be able to know. The management can be done once the diagnosis is done. Role of health work control, I will not skip. Yeah, this I discussed mode of communication.
Sir, in case of emergency, we can give teleconsultation for less than 16 years of age, sir. In case of emergency.
The emergency also, someone will be accompanying the emergency. Now, he is not going to speak to you alone.
Oh, okay, sir.
Usually 16-year boy, if emergency, we will ask him to immediately, okay, you call nearby, whoever is there. I can't tell the 16-year boy to go and get this medicine, go and get this medicine. I have to immediately call, whoever is near, please call. If he's telling no one is there, sir, someone will be nearby neighborhood, you please call him, some neighbor will come. It's always better to document. As you say, if some situation arises, maybe we can document. So no one was there immediately. Suddenly he came upon through the teleconsultation like that. It's not necessary that his father or mother should be available. Some major should be there accompanying. That's what documentation says.
Okay, sir.
Yeah, during emergency situation, I can advise first aid. I can give counseling. I can facilitate the referral. Very, very important. The referral time is very important. If it is emergency, don't keep wasting time in teleconsultation. Through teleconsultation, inform that he has to be referred immediately to a nearby hospital. Yeah, as I mentioned, guidelines for technology platforms. There are no specific platforms for teleconsultation, like only this app should be used. The clinical people, the pharmacist, the pharma people, all those things will be there that you can use as an aid, but it's not necessary that you have to use that only. You should not tell patient that you use this platform alone to communicate with me. Not like that. Whichever the patient is compatible, let him communicate. Or if you are very close to him, you can give a suggestion that this platform will be very easy for me. You can communicate to this. If he is accepting, you can do on that. And don't promote yourself through any platform. Yeah, another important thing, artificial intelligence or machine learning, which I was discussing yesterday, are not allowed. That is, without the RMP cannot It can be used as an aid, but a doctor cannot use the artificial intelligence for telecommunication. Or without me saying, I should not ask the patient to send a message, and a message I should not feed it to the software. For example, I will not be there. My technique, I am very busy practicing. My sister in the clinic, she will just see the message, what the patient said. And she will, whatever message is being sent from the patient, I will not see the message. I will be seeing the other patient. I will tell the sister, you see that message and you feed it in our software, check what complaints you sent and just check what tablet has to be given. For example, you send, sir, I am suffering from type 2 diabetes for 3 years. This is the medication you have prescribed. The sister will check that. The same medication the sister will give. That is like a type of artificial intelligence that should not be done. A doctor should directly be linked with the patient, whether through audio or video or chat, whatever it is. No artificial intelligence without the availability of a doctor. That should not be done. That's what that 5.4 tells. Yeah, this I already explained. Drugs. Drug O, anyone can use. Drug A, first consultation can be used. Follow-up consultation should be very specific. Drug B, I mentioned. Prohibited medicines, either for first consultation or follow-up consultation, never used through teleconsultation. Whether it is first consultation or follow-up consultation, no prohibited medications. The summary, I finished it. So 4 basic types of telecommunication I mentioned about the doctor, patient, and what are the media, through audio, through video, all those things. And this also I mentioned, RMP to RMP, RMP to patient, RMP to caregiver, RMP to healthcare worker. Strength, yeah, time saving, many things are there. Patients advantages are there. Limitations, yeah, physical examination I cannot do. Sometimes patient may not be satisfied that much. Record maintaining is very important. And I discussed about first consult and follow-up consult. Within 6 months means follow-up. Within 6 months, new diagnosis means first consultation. After 6 months means first consultation. Again, he comes for second time, but it is considered as first consult. Quickly tell me what is professional misconduct. At least 2 things or 3 things. I discussed many professional misconduct today. Quick, we are finishing, don't worry. For me also call coming from the clinic for a long time from the sister. Yeah, CB will tell. What are the professional misconduct which you commonly do in teleconsultation?
Sir, less than 16 years plus the 16 years age of boy should have a guardian, sir. So we can tell a teleconsultation.
Speak to him personally. Okay, one.
And then, yes, sir.
Don't use prohibited medicines. I was very
Yes, sir,
clear.
don't use
Another
Yes, sir,
thing,
if the patient is willing to teleconsultation only,
correct.
should do,
Doctor
sir.
should not force him.
Yes, sir.
Yeah, for example, now I'm here. Patients are waiting there. Since I have some time to go there, I can call the sister, ma, and the patient, ma, I will do teleconsultation. I am now in a meeting. So I am saving the time. So 15 minutes or 20 minutes it will take, and patient is waiting there. So I want to save his time. I should not tell like that. I should not ask the sister, I ask the patient to do teleconsultation. You ask him to call my number. Because the patient is already waiting there for me. So I should not do that. If the patient is in his home and is calling me, I can accept for teleconsultation. I should not call the patient for teleconsultation, as you told, correct? One more thing, without coming to a provisional diagnosis, don't prescribe any medicines. That also comes under misconduct. And don't use any prohibited medications under teleconsultation. Privacy is important. I should not disclose any information, whatever I did through audio or video, to any other patient or to any other member without his consult. Even sharing an X-ray image, I have to get his permission. Yeah, data of patient ID is very important. Patient should know about me. I should know about the patient. Yeah, the final slide. Don't prescribe medicines without coming to a diagnosis. Don't request or force the patients for teleconsultation. Don't use prohibited medicines. Don't supply online pharmacy to patient without, this is, I forgot. But anyway, for example, if I'm having my own pharmacy, I have to inform him that I'm supplying these medicines from here. All these are same medicines. I have to get the consent from him. Because he will have an option. He will have somewhere, he will have an account, or he wants to buy in specific pharmacy, maybe a friend. So I cannot force him to buy from my shop. All those things are there. You have to get consent. No ads or promotion of a doctor is allowed in any platform for that matter. Artificial intelligence or machine learning is not allowed. No data or information sharing without getting consent. Yeah, adult should be along if he is less than 18 or 16. Yeah, thank you. With this, I conclude my presentation.
Thank you, Dr. Sanjay Kumar sir, for your informative presentation and for showing knowledge light on every one of us. And I also want to take a moment to express a heartfelt gratitude to all the students here today. Your active engagement and enthusiastic participation have today made this event special, and we expect the same enthusiastic participation from you all for all our upcoming events. Until next time, it's Radhik Priya and Shibi Miller signing off. Thank you.
Someone has raised hand, ma. Guru Charan, அம்மா raise பண்ணிருக்காரா? Sir, okay. Shall we close?
Okay, sir. Thank you, sir.
Guru Charan.
Thank you, sir.
இல்ல, okay.
Thank you, sir.
Yeah, thank you, pa.